Depression and substance abuse can often go together because a person will try to medicate themselves to feel better. And so someone will notice it, as we all do, that having a glass of wine will make you feel better. But alcohol is actually a depressant, so they may feel better in the moment, of course, but then there's the downside afterwards. So then they may get into trouble because they try to medicate themselves again, and this gets into heavy drinking or drug use and this sort of thing. They don't always go together, but when they go together, it's we call it a dual diagnosis, because they have a diagnosis of both depression and a chemical dependency. Sometimes it can go the other way around too, which is that someone who starts using drugs recreationally or alcohol recreationally can develop a depressive disorder as a result of the ups and downs that the body and the mind go through and the emotions from the substances. Some of the traditional methods of treating addiction, it's important to remember that not too long ago, addiction was considered not treatable. People used to just consider that alcoholics were lost causes pretty much until I think it was the 20s or the 30s. It was in this last century that Alcoholics Anonymous was begun by Bill W. And it's very interesting, I don't know if you want this in the film, but it's very interesting that Bill W. actually traveled to Switzerland to meet with Carl Jung, the great transpersonal psychologist. And Carl Jung told him, the only way you can treat addiction, it can't be treated, the only way you can treat it is with a spiritual solution. If there's only a spiritual cure, it's the only thing that will treat addiction. So thus, Alcoholics Anonymous, AA, was started, and that was the 12 steps of recovery. And people would go in and through fellowship with other recovering people and through admitting that they had a problem and being accepted and loved for that and staying sober one day at a time. And, it's really been miraculous. And then, of course, there's been Narcotics Anonymous and other programs that have come from that. It's been miraculous for certain people. For certain people, it's been a miracle cure. It has about a 60% failure rate. Most drug programs and alcohol programs have a pretty low success rate. But you have to think, for the people that they help, they're fantastic, right? A lot of people don't want to accept a spiritual solution, so they don't want to go to AA because they don't want to talk about spirituality, and so some other types of programs have come up since then. They have tried to traditionally work with chemical dependency problems through psychological methods, doing family counseling, doing individual counseling, and these have had moderate success. And as we were talking about before with depression, they usually are best used in a holistic program where one-to-one therapy once a week isn't going to be enough, but if you include it with a 12-step program, maybe an inpatient program, this kind of thing, then that's the most highest likelihood of recovery. Another important component of traditional recovery for drugs and alcohol is going into, depending on how severe it is, going into a detox program and being physically detoxed off drugs and alcohol with the help of a medical doctor, and then often going into a 28-day program or full-time or this kind of thing to really get the person away from their family, away from things that might be leading them in the wrong direction. Really get them fully steeped in a recovery program and then return back to their life. I don't know if you can ever say an addiction has been totally treated, depending on the person, because some people will go in and to a traditional treatment program and become sober or abstinent from the first day they went in. They just really take to the program, the treatment, the self-inquiry, the fellowship and so forth, and they just really take to it, and they're sober or abstinent from that day on. Many people, there's more a process of what we call relapse, where someone will get sober and like this life and then go back to using again and then go back into treatment and be sober or abstinent again for a while and then relapse again. And I don't know that if that person's life is getting better and they eventually get off the drugs and alcohol, I think you could say that's successful, even though it's not just, if it depends how you measure it. I mean, if it's just you go into treatment and you never use again, that's not how it is for most people. It's often a series of treatments and a gradually getting better. And then again, someone could be sober for, you also have this sort of thing where someone has an alcohol problem, they become sober, and then 40 years later they become alcoholic again. So it's really, it's hard to really know how to measure that. Some of the consequences for addiction going untreated is just really counted in terms of human suffering and misery. There's certainly the mental aspects, the mental suffering. There's the suffering of the people around that love the person, the family system, the friends, the family. There's the economic consequences. People's lives often go really downhill. They lose their work. They can lose everything. Crash their car. All kinds of, it's really, as we all know, it's not a pretty sight.